Anna Hall is a clinical pharmacist. She is the Chief Compliance Officer of Outcomes Operating Inc. They are a healthcare tech company working to create thriving communities through better pharmacies and access. Welcome to the show, Anna.
Thanks, George. Thanks for having me.
Yeah, excited to have you on. Tell us a little bit about your personal life, some more about your work, and why you do what you do.
Great. Well, I'm a pharmacist by training. I've spent most of my year, though, kind of as a non-traditional pharmacist. I taught at the University of Florida and had an opportunity to jump into something that was kind of booming in the 2005, 2006 era when Medicare Part D began paying for prescription drugs for Medicare patients. And as part of that, the government required that Medicare patients be offered what's called medication therapy management. So I think when that first came out, a lot of us didn't even know exactly what that meant, but have spent most of my career having an opportunity to really shape and define what that offering would look like for Medicare beneficiaries. Um, and I guess as far as my personal life, I'm your typical mom, two kids, two dogs, lots of fun and exciting things watching them grow up. But excited to be here and excited to talk about what we're doing at Outcomes.
Awesome. No cats, Anna? Just a couple of
Oh,
dogs?
well, I kind of kept it simple with two dogs, but I have two or three cats depending on the day. One likes to come and go, and I have six chickens, and that's my animal limit at the moment. I've been known to have some goats and other farm-like animals, but anyway.
Yeah, yeah. There's some additional bandwidth. You might fill in with some goats or something else. Who knows? Who knows? Awesome.
I, I guess I am a little exciting in the animal area.
Yeah, yeah. When you start peeling the layers back, I love it. Roughly speaking, how long ago was it that Medicare Part D started paying for medication?
Oh gosh, I think that the Medicare Modernization Act, which brought that along, came around in 2003. It might have gone live in 2006, right around those years. And then those MTM programs started kind of between 2006 and 2009 um, when that kicked off. So you're taking me back, but I think I
Yeah,
have those right.
got it. And it's medication therapy management. And
Yeah.
what is the purpose of that?
So medication therapy management is where Medicare Part D plans are required to offer patients that are on a certain amount of medications or have a certain number of disease states or expected to spend a certain amount on medications overall, both what their plan pays and what they pay. Um, Medicare said, patients on medications can run into problems where their drugs might interact, they might interfere with other disease states, and if we're going to support making sure that people are on medications and staying healthy, we want them to get a medication review at least once a year where they can go over their medications with a pharmacist. I can talk about our model in a minute, preferably their personal pharmacist that knows them well, and review those medications, look for any potential problems, and really allow that pharmacist to serve as a liaison between the patient and the prescriber, helping them optimize their drug regimen so that it works for them, works for their preferences, works for their disease states, and does what it's supposed to do to keep them healthy.
I can't imagine even starting with a project like that. I know that y'all are working with almost 50,000 pharmacies, so it's so many people that are taking and gaining access to this program, and government and everybody else wanting to make sure that they stay safe and the program runs effectively. So that's just a lot.
Our platform at Outcomes really provides that connection between those Medicare plans, Medicaid plans, even you're seeing do medication therapy management, or MTM for short now. And then manufacturers have really realized the value in just having those conversations with patients that are on these critical therapies and making sure that they do well on them. So Outcomes, we really provide a connection of We have both pharmacy dispensing platforms that pharmacies are just doing their everyday dispensing work in. And then we have a clinical platform that connects those health plans to that community pharmacy to present opportunities so that those pharmacies can be reimbursed to complete that clinical care and those MTM reviews with patients. So that's the gap that we're filling, making it streamlined for pharmacists to both dispense and then do that clinical work in one platform in their everyday workflow.
And when you decided to become a pharmacist, is this the kind of work that you envisioned doing, Anna? How did
Oh
this
my God.
happen?
Yeah, I sometimes wonder that too. I had no idea. I mean, MTM was not a thing when I was
Right.
at the University of Florida in school. So um, it is, I have found a home in MTM. It is what I hoped pharmacy would be. I started in a small independent pharmacy called Magnolia Pharmacy, and I would go and deliver medications next door to a nursing home or a long-term care facility next door for patients. Actually, it was an assisted living facility next door, and take people their medications, and I would get to talk to them. They would ask questions. I'd have to, at that point in my career, I'd have to go back and ask the pharmacist and get them an answer. But I mean, it was the dream pharmacy life for me, getting to talk to people and help them with their concerns about their medication. So to end up today, and to be honest, it was through connections and staying in touch with people that I went to school with and teachers of mine, that when MTM came about, we had an opportunity to define what it would be, what it would look like, and teach pharmacists all over the nation how to do it, because it was a new thing. It was organizing, how do you sit with a patient and go over these medications, and how do you break away from that routine of dispensing all day long to make sure you have staff and you have time to spend this time with the patients. So it just kind of happened, and it's been a fun ride, and it's an exciting place to be.
No doubt about that. All right. So medication therapy management, I don't want to use the wrong term. Dispensing is here's some medication to take, and then the MTM is a consulting function. What is the right term?
Yeah, or clinical. We like to call it pharmacist clinical services. And over the years, George, the reimbursement for dispensing has gone down. Even sometimes when you fill a medication, your pharmacist even ends up, when it's all said and done, with a negative reimbursement
Hmm.
for that medication. And I don't know any profession that's in business to make negative dollar amounts. So, or even, very low margin amounts, which we've seen that margin in dispensing decline over the years. So it's very important for pharmacists right now who are trusted. This is the one person in your healthcare that you would see more times a year picking up your medications than any doctor, any other provider that you see. And they're available, they have that relationship with their patient. This is an opportunity for MTM, or what we call clinical services, for them to use what they're really trained in. They're medication experts, and the patient trusts them. They have an opportunity now to be reimbursed for their cognitive skills, for talking to that patient about how their medications are working for them, what problems there could be with them. I know people need this, because my own friends and family call me all the time just wondering, or what do you think about a drug? People just want to know that. And the health plans and the manufacturers, they need people to do well on the therapies that they're on. Ultimately, having a pharmacist work with the patient do healthcare costs, it keeps people out of the hospital. I think something like 1 in 3 hospitalizations are due to some issue with a medication. So, pharmacists are really, I think, the key. We saw it, during COVID, that highlighted for the world that pharmacists are the most accessible person. We needed to get vaccines out, right? So the pharmacists were there. I think everyone knows that. At Outcomes, we have a network, like you said, of almost 50,000 pharmacies across the nation, all in one platform. Health plans, manufacturers, whoever is needing to get that intervention done with the patient, it can be loaded right in front of the pharmacist in their everyday work. for them to maximize on that opportunity. And for the pharmacies, it's an extra stream, really becoming an essential stream of revenue back into their pharmacy.
How long before it's just robots?
Oh gosh, well, I think you're always going to need the pharmacist cognitive skills, the one able there to talk to the patient about the medications. But you're not wrong, George. You're not wrong. There are many functions in dispensing that a pharmacist has completed over the years that can be automated, that can be done by technicians. So it's critical for pharmacists. Pharmacists have been on a fight for what we call provider status, to be able to bill for their clinical work for years and years. But in April, kind of expanding on that initial requirement for MTM to be part of the Medicare Part D benefit, CMS kind of upped the ante. They expanded MTM for 2025. So there's going to be in 2025 an entirely new population of patients that are eligible to receive this service free to the patient, reimbursed by the plan to pharmacists to complete it. 2025, whole new population, whole new revenue stream available for pharmacists. So it's really critical for pharmacists to be using software like we provide and able to work into their everyday workflow, where the dispensing stuff, it can happen. It can be automated as much as possible, but that they still have this clinical stream of revenue there, and they're spending their time working with patients and helping them optimize their medication regimens.
Yeah, what a big opportunity. And how are people receiving it? Just because it's an opportunity doesn't mean that they want to, or maybe most pharmacists were like you, where they got into it to be able to have that interaction.
Yeah, I mean, I've taught hundreds of students, George, and I can tell you right now, the students coming out of colleges of pharmacy and pharmacy schools, they are trained to do this. I mean, they spend hours learning how to work with patients, how to talk to patients, how to communicate with patients, and they're ready for it. The model is there, the revenue is there, the opportunities are there. We have the largest network of engaged pharmacists. I think some of the biggest barriers that we've seen over the years and studied over the years are patients wanting to engage in that. I mean, they haven't, it wasn't a thing in the past. The pharmacist was behind the counter, not always approachable, busy, head down, dispensing medications. Patients don't necessarily realize, they might call a pharmacist friend and ask them something, but they don't realize they can talk to their very own pharmacist there. Some patients see it as encroaching on their relationship with their doctor, or afraid the pharmacist will say something to upset the doctor or against what the doctor's saying. But whether a patient realizes it or not, pharmacists are working with doctors day in and day out, looking out for those patients and the medications that they're taking and making sure there's no problem. So I'd say to patients, get to know your pharmacist. They're the easiest provider you can access. Ask them a question anytime. And if you're on Medicare, find out if you're eligible, especially coming up in January of 2025. Many people will be eligible that weren't before. Find out if you're eligible for this service and take them up on that once a year medication review if if you're someone eligible for that with your plan. And, for pharmacists, I would say, if you're not engaged, let us help you get engaged. Reach out if you're not sure how to use the software, if you're not sure how to work it into your workflow. Our model provides a streamlined process, fairly easy to document, and don't be scared. I mean, we can teach you how to do these, how to do them efficiently, and how to do them in a way that you're getting that clinical revenue so that you can support affording staff to do these clinical services.
So is it easy to walk me through that actual process? If I'm the patient walking up to the counter, you're the pharmacist, how does it go? How does your technology help?
Yeah, so if you're a patient that is eligible for a medication review, when you come in to do that medication review, we're going to go over each one of your medications. We're going to make sure we have a complete list of those. You're going to get a copy of that list at the end. this is one of the best parts of it for the patient. People love getting that consolidated list that they can have with them, that they can take to their doctor, that they can write on if something changes and keep track of what's going on and follow it on a daily basis when they're taking their medications. And then we're going to look for any drug therapy problems, is what we call them, or medication related problems. We're going to look and see, is there, and have a conversation with you. That's the key of this medication review, is it actually is required to be interactive. We're going to find out how you're feeling. Many people are on medications and they might be feeling it, but the truth is they may not be taking it because they're worried about something. They're not sure, or they think it makes them feel a certain way. I know my own mom had a medicine. She said, I'm not taking it anymore. It makes me cry every day at 1 p.m. And I don't know if that's true or not, but the truth, it's her truth. Whether that was really happening or not, she believed that was happening and she wasn't going to take that medication. So we needed to find something different. But you don't know those things if you're just picking up bottles, taking them by the labels, and no one's having that conversation. So we're going to go over a list of your medications, make sure you get a copy of that list, make sure we know how you're taking them, and then answer any questions that you have. And then if we see anything that we think is a potential concern or something we need to talk about, we'll talk to you about that. And if it's something we need to ask your doctor about, we'll see if that's something you want us to help you do. Many people really appreciate just having somebody that's willing to help them communicate what they want their doctor to know, because they're not always sure how to say that. In addition to your medication list, you get the patient gets a takeaway that's called a medication action plan. And any of those things we talked about that you might not be able to remember after our conversation, we'll document it there so that you have that to take away and think about. And we can talk about it again next time, that we get together on your medicines. So very simple. I think there's like an 80 to 90% satisfaction rate once a patient engages. They really enjoy talking to their pharmacist. Many people will say, when can we do this again? So
I can
it's a really
see,
positive.
yeah, for sure. I can see there's probably a good chunk of people who have a question, but they're reticent because they don't want to be a bother or whatever the case may be. And once they get the opportunity, hey, this is a time that I've allocated to set aside to answer all of your questions. They're probably like, oh, you know what? There's actually this thing, or I've always been curious about that. So just giving them the opportunity to um, have that conversation is powerful.
Yeah. If you ever have a question about a medication or just wondering, is this really the right option for me? Medication is so personalized. It's so what works for one person. I've taken things that I've dispensed to people and thought of it as a fairly harmless drug and looked down and my ankles were swollen up like elephant feet. Like it just doesn't work for me. And I never thought that I would have that problem with that medication. It's very personal and you're the only person that knows how it's impacting you. So being able to talk to someone and have that conversation and kind of figure out, okay, if this isn't working, what might, that's really important.
And I'm confident from a compliance perspective, Anna, that patients' information is private. When you do come up upon a case like you mentioned where your ankles swell up, is that information that can be shared with the drug maker and the doctor? People consent to that? How does that work?
Yeah. So when we're talking about providing care under HIPAA privacy laws for patients, one of the nice things about our model is it's their personal pharmacist who, you know, is a provider for this patient and works with them day in and day out. And for them to communicate on behalf of the patient back to the patient's doctor, who is their healthcare provider, those things are allowed for under HIPAA. When it comes to manufacturers and clinical programs that support manufacturers, that's a different story. When manufacturers want to support adherence programs or programs that help support patients taking a therapy and staying on it and handling side effects or just knowing how it works, the manufacturers actually don't get the luxury of knowing information back about that patient because they're not a provider for that patient. So they're typically supporting those and working with our pharmacies who have a right to be serving that patient and who already know what drugs they're on, and providing support for those medications by having the pharmacy administer that program directly with their patient. So yeah, so in those cases, the direct patient information does not go back to the manufacturer.
That's how it works. Well, Anna,
Yeah,
thank you so much for,
lots of compliance around all of that.
yeah, well, I can only imagine. I appreciate you coming on. Where can people learn more about you? How can they connect with Outcomes Operating Inc.?
Yeah, well, we have a website, outcomes.com, pretty easy to find. We have a form on there, and if you're a pharmacist, if you're a health plan, if you are a manufacturer and you want to learn more, you can just fill that out. Someone will be back in touch with you immediately. You can also find us on LinkedIn. You can find me on LinkedIn. Excited to work with anyone who's interested in talking to us. If you're a pharmacist not in our network, you got to get in. There's money available for you. I'm sure of it. If you've got patients, I'm sure we have work available for you in clinical interventions. So let us know. We'll get you set up.
Excellent. Well, if you enjoyed this as much as I did, show Anna your appreciation and share today's show with a friend who also appreciates good ideas. Go to outcomes.com. Check out everything that Anna's been working on, we've been talking about. You can find them on LinkedIn as well. If you are a pharmacist, get in touch to figure out if this is a program that you can be offering to your patients to get better results and outcomes. Thanks again, Anna.
Great. Thanks, George.
Until next time, remember, do your part by doing your best.